Hi all, this is Dr. Reshmi. In this video, we are going to see about antenatal care. So what is antenatal care? Systemic supervision of a woman during her pregnancy is called as antenatal care. It includes both examination of the advice and giving advice to the pregnant women. What are the aims of antenatal care? To screen high-risk cases, to prevent or to detect and to treat at the earliest any complications, to ensure continued risk assessment and to provide ongoing primary preventive health care. To educate the mother about the physiology of pregnancy and labor by demonstration, charts and diagrams so that fear is removed and psychology is improved. To discuss the couple about the place, time and mode of delivery provisionally and care of the newborn. To motivate the couple about the need of family planning and also appropriate advice to the couple seeking medical termination of pregnancy. Objectives of antenatal care: to ensure a normal pregnancy with delivery of a healthy baby from a healthy mother. Antenatal care comprises of registration of pregnancy, history taking, antenatal examinations, lab investigations, and to provide good health education to the couple. So when an antenatal patient comes to the first time to a gynecologist, a proper history taking should be taken, examination should be done, and investigations should be offered to the patient. So history taking. So it includes particulars of the patient like name, age, address, occupation, chief complaints with duration, past medical and surgical history, obstetric history and menstrual history in detail, family history, drug history, contraceptive history and personal history. Antenatal visits. So ideally, in the first 28 weeks, the pregnant women should come for checkup monthly once. From 28 to 36 weeks, every 2 weeks. After 36 weeks, weekly. So minimum 4 antenatal visits should be there to every antenatal woman. First visit around 16 weeks, second visit between 24 to 28 weeks, third visit at 32 weeks and fourth visit at 36 weeks. Examination includes height, weight, BMI, blood pressure. When 2 consecutive readings or more than 140-90 millimeters of mercury, evaluation of preeclampsia should be done. Pulse rate, respiratory rate should be checked for. Always check for pallor. Examine the palpebral conjunctiva, nails, tongue, oral mucosa and palms. Pedal edema should be looked for. There is physiological edema as well as pathological edema. Physiological edema is normal and subsides after taking rest, whereas pathological edema does not subside after taking rest. Breast and thyroid examination should also be done. Abdominal examination, linea nigra. So it is a hyperpigmented line which extends from the pubic symphysis to the xiphi-sternum in pregnancy. Stria gravidarum, these are the stretch marks seen during pregnancy. Fundal height should be looked for, symphysiofundal height, fetal lie, presentation, position, fetal movements and fetal parts should be checked for. Inspection of abdominal scar or any other relevant findings. Speculum examination should be done in case of excessive white discharge per vaginum, bleeding or leaking per vaginum. Bimanual pelvic examination should be done in early pregnancy as well as when the patient is in labor. Lab investigations, which means antenatal screening tests, include hemoglobin estimation, urine routine, blood grouping and RH typing, thyroid profile, FBS, PPBS, HbA1c, bleeding time, clotting time, HIV, HBsAg and VDRL. So other investigations include ECG, echo, fetal echo in case of GDM mothers, chest X-ray is contraindicated in pregnancy. Ultrasound in pregnancy. So dating scan. It is usually done to confirm pregnancy and to check proper dates in case of irregular cycles. NT scan is usually done between 11 to 13 weeks. Anomaly scan between 20 to 22 weeks. Growth scan is usually done at 28 and 36 weeks. Risk approach. In case of elderly primary, short-statured women, which means height less than 145 centimeters, malpresentation, antepartum hemorrhage, threatened abortion, pre-eclampsia or eclampsia, anemia, multiple pregnancy and hydramnios, intrauterine fetal death, stillbirth, prolonged pregnancy, history of previous LSES and treatment of infertility. So diet during pregnancy. So in the entire pregnancy, approximately 300 kilocalories per day is needed in extra to every antenatal woman. In lactation, 600 kilocalories per day. Supplementary iron therapy is needed for all pregnant women from 13 weeks onwards. According to National Nutrition Anemia Control Program, 100 mg of elemental iron and 500 microgram of folic acid should be given for 100 days in second trimester. So double the dose should be given for anemia. WHO recommendation is 60 mg of elemental iron and 400 microgram of folic acid is recommended for 6 months and 3 months postpartum also. So hygiene, daily bath should be taken by the antenatal patient. Bowel care, plenty of fluids and fiber-rich vegetables should be taken. Breast care should be given. Exercise, at least walking for half an hour to 1 hour is recommended. Dressing, always an antenatal woman should wear loose cotton dresses. Rest and sleep, the patient should have at least 8 hours of sleep at night and 1 hour of sleep in the afternoon. Coitus, it is better to avoid coitus in early pregnancy and also in the late trimesters. Warning signs, headache, blurring of vision, convulsion, vaginal bleeding and fever. These are some of the alarming signs in pregnancy, and when these symptoms occur, an antenatal patient should immediately go and visit a gynecologist. Thank you. Please like, share and subscribe if you like this video.